The veins started coming right after my first child was born. I had gained a lot of weight, and I think that was hard on my veins. And my mom has very bad varicose veins, and so it's hereditary. And I recently lost 52 pounds. And I think it kind of like I was feeling really good, and I was very athletic, and all of a sudden, it was like rejuvenating, and I just thought, it's time that I get rid of that vein and kind of like move forward and feel 100% better. And also with all the new sports and stuff that I was doing, it was difficult with the pain and the fatigue in my legs. So that kind of pushed me in the right direction to kind of get a new lease on life a little bit.
Okay. What I'm looking at is right here. This is a cross section of your greater saphenous vein. And I'm looking for any signs that it's dilated. And it is right here. So we'll take a look. I'm going to squeeze your calf. Good, hold still. Okay. So when I squeeze your leg, it forces a little blip up on the screen here. And all of this down here is blood going the wrong direction. Okay. So you have a lot of reflux in this vein that runs all the way down your right leg. Okay. And that is feeding these little varicosities that are coming all the way across here. So now I want you to turn all the way around facing towards the table, and you can relax the shorts and stay below your knee. Okay. Okay, and now I'm looking at this vein right there. And it is dilated. Okay, we'll take a look right here. And another little squeeze.
Before the surgery, I was very self-conscious about my legs. I was self-conscious about the veins. I didn't like to wear swimsuits in front of people, or shorts, or skirts that showed my legs because of the big veins. I felt like it aged me.
What we've done now is we've marked all of these large veins, these varicosities that are along your leg. We put a little semi-permanent ink mark, and you can feel these. In fact, as you press along there, there's a big bulging vein underneath that. When we do the microphlebectomies, you'll be lying down, so these will be hard to see. Yeah. So we're going to make just a little tiny micro-incision at various points across these veins. Then we're going to pluck them out with a little Venus hook. It looks like a crochet hook. But before we do that, because we're going to be poking you with some needles, it's all a needle procedure, there's no cutting, we're going to wrap your leg in a cream that'll help numb it up. This laser is nothing more than a small fiber optic piece of plastic that we send up through the catheter, and the energy is extended. If you could close up on that, there's a little gold bead that the laser energy will hit. Right there. Perfect. While I'm doing the laser, my assistant here, Holly, is going to start numbing up the veins that will take the veins out with microphlebectomies. Instead of using a scalpel blade, which can potentially create a much larger incision, I'm going to use a little admix needle. It's a needle that pharmacists use to puncture through corks. And we just make a little poke into the skin wherever these phlebectomy sites need to be. We actually use something that looks like a crochet hook. And it has a blunt tip on it, but a little hook that allows us to grab the vein. Now, we don't always get the vein. Sometimes all we can do is just disrupt it. A lot of it depends on where it's at. It'll come out. Yeah, so there you can see the vein. But we're pulling this out like a little worm through the skin. I'm going to clamp on it. Then we'll tease it out a bit. By doing this, it really disrupts the vein, and these varicosities, of course, many of them are connected together. So if you get one segment out, the rest will come out. Okay, Sarah, how are you feeling?
Still
A little sleepy, huh? Well, it helps not to remember. Do you remember anything? Not a thing.
I remember saying ouch or something a couple times, but not really.
Well, you did really well.
Good.
You had a number of dilated veins we took out. There wasn't much bleeding. Shouldn't have a lot of bruising. They're going to wrap the leg, and I think maybe they already have,
They did.
so that it keep a little compression on there. You'll need to keep that compression hose on for 3 weeks.
3 weeks, morning and night?
I generally recommend it morning and night, but if it's really bothersome, you don't have to wear it at night when you're sleeping. But anytime you're upright, you
And
should
just
wear it.
3 weeks? For
Just
some
3
reason
weeks.
I had heard it was 6.
3 weeks. That's it.
Well, since the procedure, I work out a lot, and before, my leg that got worked on would get tired really quickly and would be sore, and it would take a lot more energy, and I'd be popping aspirin. And now at first it was much harder right after the surgery, and I wasn't 100% sure it was all worth it. But now I can work out and it doesn't hurt ever, and it feels great all the time. It's great. I was walking around like to the kitchen or the bathroom or going to and from places right away. It wasn't difficult to do. You know, it was uncomfortable, but not hard. Before the surgery, my right leg would fatigue earlier, and it would be sore, it would get swollen, it just was uncomfortable a lot of the time, and now it feels really good. My husband would never admit that he likes my legs any different than he liked before. He would say it doesn't matter to him, I look great either way. Everyone's encouraging me to wear shorts when I work out, which I never have. I was wearing capris because I felt uncomfortable with my legs. If I had more vein trouble and it was as bad as my veins previously would, I would do it again. My varicose veins are now gone, and I feel so much better, and they look so much better.
Well, I'd just like to thank Sarah for being a great sport and allowing us to film this procedure from start to finish. I think Sarah is a great case study in what we can do in treating symptomatic varicose vein disease. And as you can see in Sarah's case, it's made a difference. It's allowed her to do things and to exercise with less pain and to have more freedom in her life. Of course, we see patients from time to time that are even in more serious condition. We don't simply give people an Ativan and slap them on the table and begin to take their veins out. Patients get a full, thorough physical examination prior to the procedure. We do conscious sedation so the patients are not suffering during the procedure. We have a nurse monitoring the anesthesia constantly. We are certified as a surgical center. We hold ourselves to a higher standard. At the Riverwoods, we pride ourselves in good technique. An example, we do a double surgical prep on every leg prior to the procedure. This reduces the risk of infection. We also give the patients IV prophylactic antibiotics prior to the procedure to reduce the risk of infection. We pride ourselves in giving the very best care, and our patients appreciate that. I think it's important for people to know that they don't have to suffer. This is a procedure that can be done quickly and easily as an outpatient. People can be back to their normal lives within a day or two. They don't need to worry about taking those long walks in the mall. They don't have to worry about the complications of clots in these slow-flowing veins. So I would recommend that people get treated early and that they come in and be evaluated, and we'd love to take care of you.